Okay, we're starting the third lecture, the third part of the lecture on diabetes. And we covered this slide in the last lecture, but I went kind of quickly through it. So let me just highlight important parts. Nowadays, insulin is produced by recombinant DNA technology, and insulin works by transporting the glucose across the cell membrane to be used for energy. And insulin is required by type 1 diabetics and advanced type 2 diabetics. Okay, so on this slide it talks about insulin is available in rapid, short, intermediate, and long-acting forms. It's injected separately or it can be mixed. The only insulin that we can't mix is Lantus. Now it used to be when I first started teaching this, the short-acting insulins were always clear, and the long-acting or intermediate-acting insulins were always cloudy. But when Lantus came along, it mixed all that up. So just know that there are different long-acting and short-acting insulins. And insulin is given by subcutaneous injection. And then there's one exception. Regular insulin can also be given through IV. And later on, when we talk about teaching patients that have, or taking care of patients that have high blood sugar levels, we're going to see that we can give them regular insulin in their IV to help bring their blood sugars down. And this absorption rate line here, you really don't need to know that. Just know that if we give insulin through the abdomen, it absorbs just a little bit quicker than the route of the arm, the thigh, or the buttocks. Now this next little section here, we're going to talk about the pharmacokinetics of insulin. What this means is, and I'm sure you've covered this in your pharmacology class, when we inject a medication into a patient, it takes a little bit of time before you see that drug in their blood level, and they call that the onset. And then when the amount of drug in the blood reaches the highest level, they call that the peak. And then when you no longer see that drug in the blood, they call that the duration. So there's the onset, peak, and duration. And insulin follows the same type of pattern. What I want you to see here is that the rapid acting insulins, you can see that it has a real quick onset, real quick peak, and a real short duration. And when we get down here, like to NPH and the other insulins, you can see that it has a little bit slower onset, a prolonged peak, and a prolonged duration. Now, why this is important is, as a nurse, if we give insulin to a patient, we need to make sure that we assess that patient for hypoglycemia or low blood sugar. And usually when a person is given insulin, they're usually going to react or have a insulin shock or a hypoglycemic reaction, usually when the insulin is at the highest point inside their blood. And so when the insulin is at the peak, that's usually when the patient is going to become hypoglycemic. So I want you to pay particular attention to regular insulin. You can see that it peaks right around 3 hours, and NPH, it peaks right around 6 to 8 hours. So I want you to know that one because there could be a test question on that. So let's look at this slide here. And you can see that the rapid insulin, or Lispro, this is the very common one that we give in the hospital to our patients when we check their blood sugar before meals and their blood sugar's high. It's usually this Lispro that we give nowadays to our patients in the hospital. And you can see that it peaks right around an hour to 2 hours. Regular insulin is also a short-acting insulin. You can see that it peaks about 3 hours. And NPH is an intermediate insulin, and you can see it. I have written down here 8 hours, but you guys saw that it was anywhere from 6 to 8 hours is when it peaks. Now, the reason why I want you to know these is that there could be a couple test questions on your final exam that asks if your patient receives insulin at, let's say, 8 o'clock in the morning, and let's say it's regular insulin, what time do you think that person could have a hypoglycemic reaction? And so if it's regular insulin, if they peak at about 3 hours, so 3 hours after 8 would be 11 o'clock, and that would be the answer to that question. Assess that person around 11 o'clock to make sure they're not hypoglycemic. And same question, it could be if your patient receives NPH insulin at 8 in the morning, what time do you think we would see a hypoglycemic reaction? And that would be 8 hours later, and so 8 hours after 8 o'clock in the morning would be 4 p.m. And so that's the answer on the test there. So just please pay attention to the peak times. Now I want to highlight, if you look at the Lantus at the very bottom, you're going to see that, and let's go back, you're going to see, I forgot to mention this, Lantus, it has about an hour onset, but it doesn't have a peak. It reaches the highest level, but it's consistent all throughout the day for 24 hours. Then after 24 hours, it's gone. So Lantus doesn't follow the peak like all the other insulins do. And so that's why it says on this slide here that it doesn't have a peak, but it has a continuous amount all throughout the day for 24 hours. Okay, now the next couple slides, they're kind of redundant here, but I'm just trying to make a point here. If you look at the little diagram up here in the upper right corner, you can see that this is the normal insulin concentration levels for a patient that has normal metabolism. And you'll notice that your body secretes a little bit larger amount of insulin around breakfast time, around lunchtime, and around dinner time. And so these are the three peaks when your body produces the most insulin, and they call this the prandial amount of insulin that your body secretes. And then you can see here at at bedtime, you can see that there's a small little peak, but it's not as prominent as the breakfast, lunch, and dinner peaks. So they call those prandial, and prandial has to do with mealtime. And so the body anticipates that you're going to eat a meal, and so it increases the amount of insulin for breakfast, lunch, and dinner. That's the prandial amount. And then the basal amount, that's the small amount of insulin that the body produces all throughout the day for 24 hours, and it produces just a small amount, and they call it the basal amount. Well, when we give insulin to our patients in the hospital, we try to follow the normal secretory pattern of a normal metabolism or normal body. And so if you look down here, you can see that in the hospital, we usually give insulin before breakfast, before lunch, and before dinner if they need it. And then a lot of times at bedtime, we will give them a small amount of usually an intermediate acting insulin to last all throughout the day and throughout the night. And this is usually trying to mimic the normal secretory pattern for insulin. Okay, now when we send a patient home, we do the same thing. You'll see that the patient will check their blood sugars and give themselves insulin before breakfast, lunch, and dinner, and they usually give themselves a Lispro or a regular insulin. And then at home, often to mimic the basal amount of insulin, the patient will give themselves Lantus, and it will put a small amount of insulin in their bloodstream, and it will last 24 hours, and that will take care of the basal amount of insulin that a person normally secretes or produces. And so here again, this does the same exact thing. I hope I'm not beating a dead horse here, but we try to mimic the normal pattern, and so we'll usually give a insulin to a diabetic patient at breakfast, lunch, and dinner. That takes care of the prandial amount, and then we'll usually give them a long-acting that will take care of that basal amount, and we just try to mimic the normal pattern in the body. Now, one thing that where this is problematic, a lot of diabetics don't like this because it requires that they receive usually 3 or 4 injections per day, and if you're a diabetic, you don't like to give yourself so many injections, but it requires usually injection before breakfast, before lunch, before dinner, and then often an intermediate or another injection sometime during the day. Now this slide here, I can see some test questions here. These are the things I want you to know about insulin, and you guys know these. The normal sites that we inject insulin would be the upper arm or the back of the arm, the abdomen, as long as it's 2 inches away from the umbilicus, the thighs, and the buttocks. And these are the most common sites. The angle that we usually use for insulin is 90-degree angle for most adults. If the patient's really, really thin, we can use a 45-degree angle. Remember, bevel is up. The time that we usually give insulin is AC and HS. AC stands for before meal, and HS stands for at bedtime. And we want to make sure that we usually give the insulin about 30 minutes before the meal. But we want to make sure that they're going to receive a meal, because we don't want to give them insulin without them having food to follow. Like we said before, insulin can be mixed. The only one that we can't mix is Lantus. Now the primary complication or side effect of insulin would be hypoglycemia. And so as a good competent nurse, we always want to make sure that we're assessing our patient for hypoglycemia. And a little acronym that we're going to use is cool and clammy, give some candy. And that has to do with what we do when someone is hypoglycemic. And we'll learn about that in a few slides. The concentration of most insulins is 100 units per milliliter, and it usually comes in a 10 milliliter glass vial. Often at home, this will be refrigerated. At the hospital, a lot of times it's just kept in their med drawer. The syringe that we use is a 3/8 to 5/8 inch insulin needle, and it usually is a 25 to 27 gauge. And remember, a lot of the ones that we use in the hospital are orange in color. And then storage, like I mentioned before, often at home, insulin is going to be stored in the refrigerator, but when we administer it to our patients, you want to make sure it's at room temperature. And then the last thing that's listed there on this slide, it says insulin pumps. And this is a relatively new type of machinery. If you look down here in the bottom right corner, you can see that this person has an insulin pump. It's about the size of a small phone. And what it does is in the morning, the patient will put a needle into their abdominal wall, and it's hooked up to this machine. And throughout the day, the little machine will monitor their blood sugar levels, and it may alert the patient to, that their blood sugars are getting too high or too low, and then it can administer insulin, usually before breakfast, lunch, and dinner, and at bedtime, just to maintain their insulin levels and their blood sugar levels. Okay, and with this slide here, I'm going to wait for the next section number 4. But when we get to nutrition and diabetics, we're going to see that it used to be a pretty complicated thing that was real hard for diabetics to handle. But let's talk about that in section number 4. So I will see you in just a little bit.